instructions.
HIV tests used to take weeks. Now it's just a minute. These 3 little vials and a drop of blood is all it takes for a clear diagnosis. This community clinic performs 9,000 HIV tests on people a year. The director says demand is as strong as ever, and getting these kits on pharmacy shelves and in people's hands could meet the need.
A real option of a fast test, but also a private test and something they can get outside the health authorities.
Canada's HIV numbers aren't going down. There's a new diagnosis every 4 hours. It's an infection rate similar to the European Union's, but Canada is falling behind high-income countries like Germany, Sweden, and Australia. And some Canadians are more vulnerable than others. Black and Indigenous people are less than 9% of our population, yet make up almost half of new HIV cases. Experts estimate as many as a quarter of people with HIV have not been tested for it. Stigma is part of the problem. That's why Mike Smith didn't get tested when he was growing up north of Toronto. For Smith, getting professional advice about sexual health was not an option.
This doctor was just not open, was very judgmental, and I always felt nervous going to doctor's appointments, even if I had the flu.
I would be too.
Smith works to encourage men to get checked for their HIV status. Even with better access to testing in the healthcare system, barriers remain.
People don't want to go to an overcrowded sexual health clinic to get tested. People still fear facing homophobia from their doctor. These things can be addressed with a home self-testing kit.
Inside your self-testing kit,
That's why the European Union approved the same take-home tests for sale 3 years ago. Health Canada wants clinical trial evidence from Canada before it does the same. The researcher heading that trial says Canada is playing catch-up, not just in approving the tests for sale, but in attitudes towards HIV self-testing.
This is going on around the world, right? And we know it's working. I think, Canadians are very cautious, in some ways perhaps a bit too paternalistic about this. We have to put confidence in people and give them choices.
Giving people that choice could mean the difference between getting treatment and infecting others. Vic Adopia, CBC News, Toronto.